Are you struggling to advance your career and sacrificing time with your loved ones because of endless to-dos, low energy, and just not enough time in the day? If so, then this podcast is for you. I am your host, Dr. Ann Sung, an ER, critical care, and space doctor, a peak performance coach, real estate investor, and a mother of a toddler. I'm here to guide you on mastering your mind and give you the essential skills to achieve peak performance. So welcome to Productivity MD, where you can learn to master your time and achieve the 5 freedoms in life. Hello, welcome to Productivity MD podcast, and I am your host, Dr. Ann Sung. And today we have Dr. Nerissa Kreher. She is a peds endocrinologist and has since pivoted actually to become the chief medical officer of a biotech company. And I just love talking to physicians who pivot and actually explore other spaces so that they can achieve the 5 freedoms. Think about outside of, what's possible other than working in the hospital and the clinic. So that's why I wanted Dr. Kreher to come onto the show. So thank you so much for coming on. And please tell us a little bit more about your journey and why do you do what you do currently?
Sure. And thanks so much for having me. So pediatric endocrinologist, as you said, I was very interested in clinical research during my fellowship training and got a master's in clinical research with the goal of doing academic clinical research. That plan sort of fell apart when the hospital, Mass General, that I was planning to have a role, actually had budget cuts, and they offered me a job, but doing clinical medicine. And I think that, was the first time that I really said, what do I truly want? And was true to that and didn't just take that role so that I had a job. I continued to look, and that's ultimately when I transitioned to pharma and biotech via a networking opportunity. Someone that I had worked with asked for my resume. And so just a year out of fellowship, I transitioned into first medical affairs. This is almost 20 years ago now, and I've had the opportunity to work in a number of companies, both larger and small, and both in medical affairs as well as clinical development, and ultimately have, progressed through the ranks to the level of chief medical officer.
What exactly, just to kind of explore this a little bit more, most people, sometimes they would not know what a chief medical officer for a biotech company does. Could you explain it a little bit more?
Certainly. So the chief medical officer is part of what we call the C-suite. So, in the C-suite, they are responsible for all aspects of the people underneath in the company. So, for example, I have responsibility for clinical development, for clinical operations, regulatory, patient advocacy. And so I have people reporting to me at the VP level, the director level, where I had been in the past and risen up through.
How many physicians are typically working with you in this group?
Yeah. So the company is a relatively small company, and I currently have 3 physicians working under me. It can vary depending on the company size. Many big pharma companies, though, have hundreds of physicians working. Even a Pfizer, for example, it's thousands of physicians.
And why would a physician want to pivot into this space if they're, if they didn't know anything about it or they had an inkling about it? Why would they give up clinical medicine, or do they have to give up completely clinical medicine to get into this space? What's so attractive about this space?
Sure. So I like to talk about 3 different roles, and they have different attractions. So clinical development, medical affairs, and pharmacovigilance or drug safety. All of those offer people opportunities to continue to use their clinical skills, but in a way that doesn't require them to see patients. So there is a lot of flexibility in the pharma roles from the standpoint of, there's not a patient waiting for you in the office. And so your workload can be accomplished with more flexibility. That is a huge driver for people these days, where they're looking for some work-life balance, for example, or maybe they're just not satisfied with a day-to-day clinical medicine role. Certainly, it's not appropriate for everyone. The physicians that are out there enjoying clinical medicine every day, they're probably not looking at biotech and pharma. But for those who are looking for different ways to utilize their skills, it's a great opportunity to consider.
And is there a specific specialty that is more suited, or really it can be from different specialties depending on which type of company?
Yes. So different specialties. And, I'm a huge proponent that we're physicians, your audience that's listening, we're physicians. We've done very, very hard things. And so working in pharma and biotech is available to all specialties. Now, there are specialties that are sought after more. There's lots of oncology drug development, for example. And so oncologists are sought after, rheumatologists, immunologists are others. But, I've had the opportunity to work with general pediatricians who have landed in pharma, with internists, with family medicine physicians. So there really are opportunities for all specialties.
And you're talking about flexibility, so it can be remote, potentially 100% remote, and more flexible in terms of, if you have children, that the hours can be flexible. Is that correct?
That's correct. So COVID really changed the working environment. Many roles are now remote, and some have moved to what we call hybrid, where they want you to be in a headquarters office some number of days, depending on the company, depending on the manager. But lots of opportunity for, remote work from home in these pharma roles. Um, and, from the standpoint of thinking about children, thinking about that work-life balance, it is a great example of maybe you can get your kids off to school more easily, right? Or meet them at the school bus at 3 o'clock if there's not a meeting scheduled that you need to be. Whereas again, if you're in clinic, that opportunity is perhaps lessened.
Yeah. And what is like the monetary compensation compared to being a physician, like a full-time physician?
Yeah. So this is very different. So it's not based on your specialty, which is something for people to really wrap their head around. So a going in rate is typically in the mid to higher 200s for most director level roles. And that's where many physicians will be starting. So the compensation for a pediatric endocrinologist like myself, that's really nice compensation, right? For an orthopedic surgeon, that's going to be probably a pay cut. And so physicians have to think about that from the standpoint of their specialty is no longer going to drive it. On the flip side, there's room for lots of acceleration in salary as well, which I think, again, is different than clinical medicine, where as you increase in your title in pharma and biotech, your salary goes up. And so I'm talking, into the 300s and even 400s. And that's base salary. There's also a bonus structure included. And then you have to think about things like 401k matches, stock and equity opportunities. So you're really considering the whole package, and also considering, I think, the hourly rate that you're getting paid, right? Because there's not on call, there's not weekend time. So there are trade-offs to be considered there.
Yeah, you're not, doing your notes at home, essentially, after clinic.
That's exactly right. Yes.
Yeah, because I do, a lot of the clients or a lot of the physicians I've talked to, they go see their patients, peds or, internal medicine, family medicine especially, but then they're doing notes until nighttime. So their hourly rate, if you divide that out evenly, drops significantly. And, with this pivot, it sounds like they can get location freedom, they can get time freedom, they can be on the path to financial freedom for investments, or maybe get equity in the company, et cetera. So it sounds like it's a path to at least three of the freedoms, not the physical, the vitality, but at least three of them.
Right, exactly. And, even from the vitality one, I like people to know, and I'm not saying that this doesn't happen in, hospital settings, and clinical settings, but there are a lot of perks. So companies are trying to be very attractive to recruit people, right? And so things like, um, you know, being able to get gym reimbursements, things that help your vitality from the standpoint of cultural activities, being exposed to other cultures through activities that the company is participating in. So it's much more corporate than clinical medicine typically is. And so there are exposure opportunities that I think many people don't see in clinical medicine as much.
And do you think that physicians have an easier or harder transition into corporate? We don't get taught about business or becoming an entrepreneur. Things might move fast depending on the size of the company, or things might move very slow. So I'm curious if it's like a more seamless transition, or because physician can learn anything, or they have like a tougher time depending on the person.
Right. And that's a great question. It's actually something when I'm talking to people about the transition that I make sure to raise to them. So I think that physicians are highly capable of making the transition. One of the big things they have to consider is that they're no longer sort of the only decision maker. And I recognize now in clinical medicine, insurance has a role, lots of other things have roles, but the physician is now working in a cross functional team and will have to accommodate for other factors like budgets, for example. The slow and fast pace, I think, is something that people also need to be aware of. And that might be, in a smaller biotech, things might move very quickly, maybe not as many hard and fast rules. We're sort of building things as we're growing them. Whereas in a larger pharma company, maybe there are lots more processes and procedures that people have to understand. So it is a consideration for people to really understand as they're making that transition.
And is there a potential possibility for part-time work if people want to keep up their clinical skills? Can they do it part-time? Is that common or not common?
So it's not as common. I do get that question a lot. There are roles where people are able to keep maybe a half day, and I think a day clinic would be a big ask. There are also opportunities for, mentoring a fellows clinic, for example, where you're not necessarily having to deal with the day-to-day patient care, but you can still have that touch point. That's a negotiation you have to make with the company and your hiring manager.
Got it. And I'm going to pivot a little bit to the how if people are thinking about this and they are interested. And I know you do coaching on for physicians who want to pivot. What would be the top 3 steps for them to do if they want to get into this space?
Sure. So, first is understanding those three different roles that I mentioned. And, there are lots of opportunities to learn about those, but that helps them to understand what are they really going after and is it attractive to them? The next would be you have to have a resume. So many of us only have an academic CV or curriculum vitae, but you really need a resume. And so that's an important step. And then the other that I would focus on is increasing your networking skills, especially via LinkedIn.
I'm like, I don't know much about my LinkedIn because it was like one set up and I haven't logged in and I haven't responded to messages for like years.
Yes, I hear that a lot. So, I work with clients on setting up LinkedIn profiles and really understanding how to utilize the platform to build their network.
And regarding the 3 categories, could you expand on them a little bit, or where can they find out more? Is there uh, a specific resource that is optimal?
Sure. So I actually have a resource, a free download on my website that describes clinical development, medical affairs, and pharmacovigilance, goes through what a day typically looks like. There is a very active Facebook group that people who are looking for roles and interested in not just pharma, but other opportunities like utilization management and such. So that's a great resource. And then, obviously Google or ChatGPT, those are opportunities to get more information as well.
And where do they find your resource?
Yeah, so my website is industrymdcoach.com. And I also have blogs. So I publish a blog every week with lots of information there as well.
Okay, awesome. And then regarding the resume, can you explain what the difference between CV and resume and what actually needs to be eliminated and added?
Certainly. So a curriculum vitae, can be many, many pages long. And it's really just a list of what has occurred in a chronologic fashion. But it doesn't actually describe what you did. And so when we translate it to a resume, we're translating it to the use of active verbs. So, for example, if you on your CV, maybe you have, um, pediatric endocrinologist, associate professor, Indiana University. That doesn't really describe anything, right? So in my resume, I'm going to say, led the fellowship clinic, and really describe what I did so people get a picture of what your skill set actually is.
Is there a specific skill set that they're looking for a must have, would you say?
Right. So the clinical skill set is really the most important. When they're looking for a physician, they're looking for all that medical training we have and all that medical experience we have. So that's the first. But there are softer skills that they're looking for. They're looking for leadership. So people who have been involved, and as physicians, we're all always leading, right? We're leading teams. So if you're rounding, you've got a team, you've got a nursing team. And people don't always translate that as well or give themselves credit for that as much. So leadership would be a really important one. Another one is the ability to work cross-functionally. So you need to be able to translate our medical language. If you can only speak to another physician and you can't sort of explain things to patients well or explain things to people that don't have a medical degree, that's going to be difficult. And many physicians, of course, that's not a problem for them, but we need to bring that forward and help people understand that skill that you bring as well.
Yeah, I can definitely relate to that because at NASA, we got to be able to translate medical to engineers whose, their discipline's very black and white on the dot with exact measurements. Everything's very precise, but I mean, medicine, it's like, it could be this, could be that. I don't know. We'll see about how the patient responds, and then we'll pivot and change our management.
That's so funny you say that because I also experienced that with, we work closely with sales and marketing, regulatory. And when a physician says that, I think people think that it's hard and fast, there's a diagnosis or there isn't. And obviously, medicine is much more gray than that.
Yeah, I agree. And what would you say would be your top skills or strategy that you employ to kind of keep up your performance? Because as a CMO of a company, and keeping up with your family, your personal life, we in Productivity MD, we're always curious in, the top strategies that people use to achieve that peak performance or productivity.
Yeah. So the 80-20 rule, some people refer to as the Pareto principle, I think is just really important for overachievers like many physicians. So as I think back, I'm 51 years old, and early in my career as a young mom, especially, I wanted to do everything perfectly. If it was the bake sale at school, I wanted to bake something. I wanted to, decorate it myself. And that, I think, actually took a lot of time away from my kids. And instead of like spending time with my kids, I was spending time to do something to make myself look a certain way. So being able to really be honest with yourself also about what do I really want to do? I really didn't want to make those cupcakes and decorate them myself, but I did it out of this obligation. And so it's two things mixed there, right? It's being honest with yourself about where you really want to spend your time and trying to push away some of that guilt and obligation. And then that 80-20 rule really applies to that as well. So, maybe go buy the store-bought cupcakes and take them to the bake sale. That allows you to really focus on what's important. And I think that as I look back now that I'm an empty nester, I don't regret anything about how I raised my children, but I do wish that maybe I had been a little more honest with myself about how best to really spend my time.
Yeah, yeah. I mean, don't essentially, it sounds like don't just do what you want to do instead of doing it for other people.
That's
Instead of doing it so that get approval, like external approval for other people. So I think as we get older, we stop caring more and more.
It's so true. But when I'm mentoring younger, not always just physicians, but younger employees, it's something that I share with them because I do think that, if you hear it enough from someone, then maybe you can start to apply it earlier in life, and not wait until you've gotten older
Mhm.
and feel free to do those things.
Yeah, yeah, I agree. And anything that else that you found had been useful or helpful, like anything like your own coaching or any other strategies that you've enacted that's really helped you along your journey to be, at your top performance?
Absolutely. So I'm a huge fan of coaching. I mean, I'm a coach, but I utilize coaches throughout my life. So executive coaches, I still use executive coaches from a professional standpoint. Coaches related to entrepreneurship and how I'm thinking about my coaching business, and then life coaching to help with everything else, right? Relationships, kids, etc. So just a huge fan of really getting your thoughts out and being able to explore, what they mean and how you're managing your mind.
Yeah, yeah. We always want somebody who is more objective to kind of tell us, or really somebody to challenge us to think bigger,
Yeah,
actually, or focus more. Because we tend to want to do like a lot of things, have a lot of ventures or ideas. So when you can be focused, that's when you can make the progress, actually. So
absolutely. And we really, again, as overachievers, we sometimes feel like we have to do it all or understand how to do it all. And a coach can help you get to your goal so much faster if they already have that experience. So being able to lean on people, be mentored, you really can achieve much, much more that way.
yeah, yeah, I totally agree. So then I guess, well, I want to share like where people can find you for the people who are listening to this. Because, if you contact Nerissa, she will help you get there way faster than if you're just exploring this on your own, of course. I often say that you're paying, for the same results. The difference is that you're paying either with your time or money. Essentially, you're buying time back. So where can people find you? And, either on the website, social media, etc.
Absolutely. So the website again is industrymdcoach.com. Lots of information. That's the best place to find me. I'm also on Instagram as well as Facebook. Instagram is the Pharma Industry MD Coach, and Facebook is Industry MD Coach.
Got it. And what would you say would be one major action for the audience listening to this?
I would say if you're interested in making a transition to pharma, getting comfortable with networking is a critical step that most people cringe about. So, really putting yourself out there, starting to make connections, and networking will be critical.
Is there one event they should go to?
Mhm. There's not a great pharma event. Maybe that's something I should do. But I think really LinkedIn is the place that they need to go. I'm doing air quotes around that. LinkedIn is where I would go for that type of networking. Um, no specific event.
Okay. I guess, yeah, they will have to first determine which three category they're interested in. Go to LinkedIn, search for those categories, and just reach out to those people who are in that specific category or the physicians in that category, or just reach out to you and see what the next four steps are, right?
Absolutely. And, from a networking perspective, it's thinking about who are your colleagues from residency and fellowship who are now working in pharma. You'd be surprised if you actually search, there's some percent that are. Who are the medical science liaisons or pharmaceutical sales representatives that they know? So really sitting down and making that list is how they start to build out that network. And obviously, I'm a huge proponent and happy to help people network as well.
Awesome. Thank you so much for the tips. And, I didn't know much about this. So this is all new to me. I learned quite a lot, and I know the audience did as well. And just so that everybody knows, of course, everything that we discuss is going to be on Productivity MD show notes. So you can just go to productivitymd.com. And Nerissa, thank you again so much for your time and your presence. And I know there are some physicians who are just stuck in the golden handcuffs and are doing notes till midnight that they're going to find this very helpful.
Wonderful. Thank you again for what you do with your podcast and for having me as a guest.
All right. Thank you. And for everyone listening, just remember that everything we need is within us now. Thank you. Disclaimer: this content is for general information purposes only and does not constitute the practice of medicine. No doctor-patient relationship is formed. The use of this information linked to this content is at the user's own risk. The content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice for any medical conditions they may have and should seek the assistance of their healthcare professionals for any such conditions. The views are personal views only and do not represent any university or government institution.